everyone. My name is Danielle Friz, and today I'm going to talk to you about a day in the life as a nurse. So as the trend is, get ready with me for the day in the life of being a nurse. So just a little background, I graduated from Timberland High School in 2016 in Wentzville, Missouri, and I was involved in HOSA in my local chapter and the state chapter. I went to UMSL, or the University of Missouri St. Louis, graduated with a nursing degree in 2021. And then since 2021, I've worked as a nurse at Barnes-Jewish Hospital in St. Louis. Okay, so when I was at Timberland High School, I was involved in the local HOSA leadership team and chapter. And so I just attached some pictures of some fun memories I had with HOSA. The top left corner is when we did the polar bear plunge for fundraising. The middle is when we volunteered at Rock and Roll Marathon in St. Louis, handing out water to participants. The top right is one of the international leadership conferences in Florida. The bottom right is when we competed at the state conference in Rolla. And then left corner is just a picture of our group one year for the yearbook. And of course, a HOSA cupcake in the center as well. And so when I was at Timberland, I was on the executive board and I was the community service chair, helping plan some events like these. So I was fortunate enough to go to 3 international leadership conferences in Orlando, Anaheim, and Nashville. So these are just some pictures of the groups I went with and myself in Nashville, and had a great time with those and learned a lot. So just sharing some memories there. My senior year of high school, so from 2015 to 2016, I was the Missouri HOSA secretary and treasurer at the state level. And in 2015, I was able to attend the Washington Leadership Academy as a state executive officer. So here's just some pictures from that. I had some really great experiences learning from others in HOSA across the country and networking, and it was wonderful. So I'm very fortunate I was able to go to that. Okay, so kind of getting started, where do I work? So as I mentioned, I work at Barnes-Jewish Hospital in St. Louis. I work on a 24-bed inpatient unit caring for patients with gynecologic cancers or additional gynecologic conditions. So perhaps maybe ovarian cancer or endometrial cancer, and also patients without cancer, maybe they have like something like pelvic inflammatory disease, vaginal bleeding, and so just different types of patients on our floor there. They may be admitted to our floor from the emergency department, other hospitals, post-surgery. We do have a lot of post-surgical patients, or our established patients can also come directly from home. So just some pictures of me when I graduated on the left, and then working in my unit. So, okay. And to kind of go into a little bit more about our patient population, like I mentioned, we take care of patients with gynecologic cancer. And as you can see in the picture, includes ovarian, uterine or endometrial, cervical, vulvar, and vaginal cancer. So the top 10 admitting diagnoses for the patients on our floor, like why they would be coming in, um, would be nausea, vomiting, pain, vaginal bleeding, fever, a pelvic mass, pelvic inflammatory disease, urinary tract infections, electrolyte imbalances, wound infections, or anemia. So they might need a blood transfusion. And the top 10 procedures we do on our unit, as I mentioned, a lot of our patients are getting surgeries, and so we're caring for them after surgery. So a lot of total abdominal hysterectomy and bilateral salpingo-oophorectomy. So they're taking out the uterus and the ovaries for patients with cancer or concerns. A vaginal hysterectomy, tumor debulking, taking as much of the tumor as you can to kind of help with the cancer progression. Percutaneous nephrostomy tube placement. So if the patient has, urinary problems or needs like a diversion to help their urine exit their body, they would get a PCN. Abscess drain placement. So again, just a drain to kind of get rid of some fluid that is building up in an abscess. Pelvic exams or pap smears, central line placement. So if patients are going to be getting chemotherapy, um, most of the time it's beneficial for them to have a central line just so we're not having to place new IVs. There's less of a risk of the chemotherapy like extravasating into their system. And then PET scans, CT scans, and MRI. So a lot of diagnostic scans to determine their cancer progression and kind of tell us how we might go about treatment or future plans. Okay, and so a disclaimer for this day in the life, get ready with me. I've learned as a nurse over 3 years that every day is different and there's no day that's the same. So it's really good to be flexible and just kind of do what you can to take the best care of your patients. Um, a typical day is hard to say, but just kind of talking about a lot of things I do in every day, and so this this is a general overview, but like this says, every day is different. And so always be ready to adapt to those changes. Okay. So I work the night shift schedule. I actually work tonight and tomorrow night. So my shift starts at 7 p.m. and I'll get off at 7:30 a.m. in the morning. So like a 12-hour shift. And so my typical day before my shift, so that would be a day like today. I would sleep in hopefully till around 11 o'clock, which is what I tried to do today, just to make sure I get some extra sleep. A little bit later, I'll prepare like my dinner and my snacks for my food. For my lunch break at work, I mean, I really like Uncrustables, so I always pack an Uncrustable. I like to clean and organize my house, just make sure everything is set and ready for me to go into work. If I need to run any errands, I do a lot of Amazon returns are usually what my errands consist of. Um, so I would do that or go to Target, get some things I need. Also get coffee for my day because that's kind of how I energize myself. Also relax, do some laundry if I need to. And I live about 40 minutes away from work, so I usually leave between like 6:45 to 6 p.m. just because I like to get to work a little early to kind of prepare myself for the shift. Okay, so the start of my shift. I like to get to work about 6:30, anywhere between 6:30 and 6:50 is when I like to be sat and like ready to work. But I don't clock in until 7. So I write down my assigned patients. So our charge nurse for the day will assign us patients that we're going to be taking care of that night, based on their acuity. So how much time, care, should be dedicated to certain things for certain patients. Like for example, if a patient is going to be getting chemotherapy, that needs like preparation for them to get medications and lab work and everything. So that's taken into consideration for the assignment. Um, and so I write down my assignment and I read the patient charts and write down the information I want to know before I get report from the day nurse. And so I like to know, like, why are they here? What have their vital signs looked like their blood pressure, heart rate, oxygen saturation? What were their lab values last night? What are the provider orders? So the physicians, nurse practitioners will put in orders for the patients. Um, like check their blood sugar every 4 hours or something to that effect. It's just making sure I know everything that I would need to be doing. And also the medications they're going to be getting during the night. And that also really helps me kind of plan out, like which patients I need to see at a certain time and others, how I can kind of work around their schedule that works out for everybody. And so at 7, we can get a bedside shift report. So the day shift nurse and I will go into the patient's room, I'll introduce myself as their nurse for the night. Kind of just give give them a rundown of kind of what the plan is and hear from their day shift nurse how their day was. Also like to check in with the patients if they need anything, if they need to use the restroom, any pain medication, if they order dinner, because I'm in my hospital, they can order dinner till like 7:30. So it's nice to know if they plan to order dinner, if they've done that already. And if they have any questions for me as the night shift nurse, special requests, like some people like to take a sleeping pill when they go to bed, and that might not be in their scheduled medications, but it's in their as needed medications that they would just need to ask for. So I always like to check in and see if there's anything I need to keep on my radar. And so I've also attached like a pain scale to this slide, just kind of gauging their pain. Usually we ask them 1 to 10, 10 being the worst. But if they aren't really able to give a number, just kind of show them this chart and see how they're feeling and everything. So, okay, so these are typical routine tasks for every night shift. And the start of the shift, the first 4 hours, so 8 p.m. to 12 p.m. are always the busiest. So during this time, I would complete my nursing assessment. So I would listen to their heart and lungs, their belly, see if they have bowel sounds, um, things like that. And then their bulk of their like nighttime medications would typically be given during these first 4 hours. So I would see if they need antibiotics or like the sleeping pill, pain medicine, anything like that. Um, and then I would obtain blood work. And so it depends on the provider orders, but our providers like the patient's blood to be sent at the beginning of the shift so they can look at it throughout the night. And if they need a blood transfusion, any electrolyte repletions, they're able to get those on my shift. And so we also check vital signs every 4 hours just to kind of keep a trend of how everybody's doing. Um, if patients are having low blood pressure or, high heart rate, then they might get like some IV fluids. So it's good to know like those data points to like provide them with their care. And then other nursing tasks I'm kind of working on during this time, placing IVs and accessing ports. So a port would be like a central line device for the patients, um, and just making sure that they could get their fluids, medicines, chemotherapy, things like that. Um, Inserting NG tubes and Foley catheters. So an NG tube or a nasogastric tube is inserted through the nose and goes into the patient's stomach. And we use it a lot of times on my floor for like decompression. Because with the gynecologic cancers, they can have like abdominal metastases um, or tumors around that area. So just kind of helping to alleviate that pressure with the NG tube and Foley catheters, if they're post-surgery or have some type of urinary issue that we're helping with that. Dressing changes and wound care, if they have any, dressings from surgery that we need to be changing or any sort of wounds, I would be checking those. Um, and then charting is something very important that you do throughout the entire shift, but just making sure that the tasks that are being completed for the patient and the care you're providing is documented in their electronic medical record. Um, this is very important just for, helping future shifts and the future care of the patient. Make sure you're doing everything you're supposed to. As we say in nursing school, if it wasn't charted, it didn't happen. So very important to keep track of the care you're providing and what you've been doing. And then et cetera. So other tasks, of course, come up too. Okay, so also routine tasks. So like I mentioned in the other slide, we do vital signs every 4 hours. And so we also do like these periodic checks every hour, but every 4 hours we're checking vital signs, reassessing if there's any changes with the patient. Do they maybe have some bleeding on their dressing that we need to address, or their mental status seems to have changed? Also to check their pain level at least every 4 hours, just to make sure they're consistent. And of course, if the patient said that they were in pain earlier, I'd be checking more often if their pain's gotten better. But if they told me at the beginning of the shift they weren't having any pain, that's great. I would at least check, at 12 to make sure that they're still not having any pain again. And then their intake and output, how much fluids, you know, are they drinking? How much IV fluids are they taking in? And then how much are they putting out? So how much, urine output have they had or like stool output? It's important to kind of calculate these things to make sure the patient isn't retaining fluid, they're well hydrated, their kidneys, bowels, everything's working well. So also just documenting these things at 12 and 4. Um, so in between 12 and 4, So the other things I was doing at 12 and at 4, I'm also administering medications, performing more nursing tasks. Sometimes we'll get admissions, discharges, or transfers in the middle of the night. Admissions are more likely. So if a patient is being transferred from like another hospital or from the emergency department, they could come up to our floor at any time, but usually in the early hours of the morning, they'll come by ambulance or be transferred. And then I get a 30-minute lunch break. So I usually eat around like 2 a.m. I have a lot of these Velveeta mac and cheese for lunch. Um, and so that's my lunch break, and that's usually what I have. I don't like to eat something too heavy overnight, um, just because I don't want to feel nauseous or anything, but that's typically my go-to. Okay, and so we're already towards the end of the shift. So starting at 5 is really like crunch time, as I say. So the providers do their morning rounds starting pretty early, because we're a post-surgical floor. So they'll come in anywhere between 5 a.m. and 7 a.m., chat with the patient, ask how their night was, and then put in more orders for nursing to complete. So at this time, I'm checking the orders. Possibly they would like a scan for the patient. I would take them down to CT or MRI if they would need that at that time. If they possibly want more blood work, maybe their hemoglobin was a little bit low or their electrolyte balance was off, and so they just want to double check in the morning and make sure things are consistent. They might start a void trial for the patient. So basically, what that means is after surgery, if the patient has a Foley catheter, at this time in the morning, I would remove the catheter, and a void trial would be that the patient has 6 hours to try and urinate on their own to make sure their bladder is working. Because when they do have a catheter and after getting anesthesia during surgery, their bladder takes a little bit to wake up. So at this time, just remove the catheter and make sure that they can kind of get on that post-operative healing process. And then just et cetera, any other orders or tasks that need to be done, possibly like an IV dressing change or a central line dressing change, taking patients, down to scans or anything like that. And then I also like to set the next shift up for success, so the day shift. So I try to complete as many of these tasks and orders that I see coming in just to make sure it's not, left over for the next shift. I like to kind of tidy the patient rooms, fill up their water, ask if they, need to use the restroom or anything, just so, again, when the day shift nurse gets there, they're not like playing catch up with all these things that could have been done overnight. And then I just like to review my report sheet and make sure I'm conveying any sort of information to the oncoming nurse that would be good for them to know, like if the patient is expected to go to surgery or kind of what the plan is for today and kind of helping them out with their plans as well. Okay, so the end of my shift, from 7 to 7:30, we have a daily morning huddle. So this is a picture, this is my manager giving us our huddle in the morning. At this time, she's addressing any concerns overnight, if there were any falls, safety events, anything like that. Just kind of feedback on anything we would like to address at this time. She's also providing updates system-wide versus on our unit. So if there's changes, within BJC that we need to know about or changes on our unit, possibly some rooms might be shut down for construction or just kind of things to keep in mind for the day. It's good to, be involved and know kind of what's going on. And then she always reviews our key performance indicators. So this would be like data that's showing like number of falls for the year or number of central line associated bacterial infections. So kind of these benchmarks keep track of how the patients are doing and how maybe we can make adjustments in our care to prevent, more urinary tract infections or more falls. Like what practices can we implement to improve these things so that we take good care of our patients. And then so I also do an after huddle, just addressing questions. She always tells us to have a good day. And then I do bedside shift report with the oncoming nurse. So again, we go around to our patient's rooms. I introduce her, she introduces he or herself. Um, and then I tell them about the night, tell them about the plan, and then if they have any questions or requests, I'm happy to try and help them out with that. When we're doing bedside shift report, sometimes more orders come in from the provider team. So let's just say they were to put in another order to get blood work. I, might grab that blood work before I leave, just so that's something that the next shift doesn't have to do. And so at this time, I'll also ask the patients if they need anything before I leave, tell them, it was a pleasure taking care of them. And if I'm back the next night, I'll tell them that as well. Okay, so my shift is over and I will be driving home. So like I said, I live about 40 minutes from where I work. So I get home about 8:15. I eat a light breakfast just to help me sleep, and so I'm not waking up in the middle of the day just because I'm hungry. Maybe some oatmeal or cereal or something like that. Take a quick shower, and then I go to sleep. And I determine when I want to wake up at this time. So do I work again tonight? So that is true for this shift. I work 2 nights in a row. So I would probably want to sleep until at least like 4 p.m., just so I'm getting at least 7 hours of sleep. If I have other plans, like if I'm supposed to meet a friend for lunch or something, I might sleep till like 12 or 1, go, complete my other plans and then come home and take a nap. Just because I like to kind of be on a day shift schedule if I'm off of work, because that's what the majority of people have is a normal day shift schedule. So I would plan, when I would wake up around that. Okay, and then I just wanted to talk about how I feel nursing and HOSA are very connected. So the leadership experience I had with HOSA as a state officer, local chapter on the executive board, I feel like it's really helped in a leadership role. And so now I'm a charge nurse, preceptor, mentor to newer nurses. And so I feel like those experiences have helped me lead others and, really work as a cohesive team and be someone that they can count on. The networking aspect of HOSA was very helpful. I find I'm also networking in the nursing field and making connections with others and, talking about how we take care of ourselves and how we improve, patient care and everything. So that's been very helpful. The community engagement aspect, I kind of started when I was in high school and with HOSA. As you can see, the center picture was a volunteering event with Relay for Life. And so now I do community events with my floor, and every year we raise money for St. Louis ovarian cancer awareness, just because we're very passionate about working with our patient population. And if there's anything we can do to help fund research, support of our patients, that's something we've enjoyed doing together. Um, the education opportunities I had in HOSA. So really just, being passionate about furthering my education, and like the seminars and everything I went to with HOSA and, competing in the events as well. Um, I'm really passionate about continuing education, and I've had the opportunity to work on some certifications and things within my nursing field that I feel like has just, connected with that. And then also job shadowing. I was very fortunate to have some opportunities to shadow within HOSA. I really enjoyed, the nursing field and the care with the patients. And so I felt like just the more exposure you have to a field before going into it, the better, just because you can know what to expect and how to have the best experience that you can. Um, so yeah, just lots of connections to HOSA that I use in my day in life as a nurse and that I'm very grateful for. So if you have any questions, anything at all about nursing, I'd be happy to answer those. I've attached my email to this slide. Very happy to answer any questions if you'd like to reach out. Um, and then that is all I have. So thank you all so much for taking the time to listen today. And I hope some of my advice or information was helpful. And again, feel free to contact me and I'd be happy to talk. So thank you so much.